And typically, a new nurse graduates from a nursing program, then works as a nurse, and it's a year or two before they move into a specialty like an emergency room. This program, though, bypasses that. They get right to the ER, learning the skills to prepare them. Behind the stethoscopes, the syringes, and the patient charts, these are the faces of the nurses, the men and women you rely on if you're hustled through the doors of an emergency room. In a time of urgent care, Bridget Line is ready.
I feel really confident in the emergency department.
That confidence inspired by experience, training she received as a graduate of an extern program at Martha Jefferson for new nurses. Meredith Overstreet is the coordinator.
The people who tend to apply to this program are people who know that they want to be emergency room nurses.
They receive 6 months of classroom work and one-on-one training with a mentor in the emergency room. And think of this program as extra orientation, focused in emergency care.
The nurses come out of this program knowing what they're supposed to be doing. They come out of this program knowing how to take care of patients, and they also come out of this program with a strong sense of camaraderie with their other emergency nurses, not just the new graduates, but the ones that help train them.
In the emergency department, I've learned that you can't do anything on your own and that you always need someone else to support you, and so it's important to have people that you can trust and that you know that you can count on in those situations.
It's good for her skills and a patient's care.
And it also benefits the community because we're not just throwing brand new nurses at the patients who present to the emergency department. They are well trained.
I just feel really lucky to have as much time on orientation as we needed.
And thanks to this training, Line is one of the nurses patients can trust. Overstreet says it's proving to be a great recruiting tool. People who hear about this program want to work at Martha Jefferson. And the retention rate is high for this program, 90% in 2 years. So the nurses get the training to be successful and the desire to stay at the hospital to be one of the faces you see when there's no time to waste. Sharon Stone, CBS 19 News.